Time for a news blast from the Pep Radio newsroom. The Times-Union of Albany, New York is reporting that after the presidential election, Nathaniel Gray saw an increase in worried callers phoning in to the Pride Center of the Capital Region, an advocacy group for the LGBTQ plus community in upstate New York. The callers spoke of mental health episodes, anxiety, depression, and plans to leave the country, said Gray, who is executive director of the organization. Callers have also shared concerns and fears about the incoming administration's promises to restrict health care for transgender people. And these calls to the upstate New York group aren't coming just from the locals, but from out of state, too. Now, advocacy groups and health providers are bracing for any potential impacts to transgender patients and gender-affirming care that the new presidential administration may bring. Throughout his campaign, President-elect Donald Trump has made numerous remarks about rolling back access to gender-affirming health care, such as hormone therapy and gender affirmation surgeries. Trump has repeatedly alluded to gender affirmation surgeries for transgender minors, despite studies that show that gender affirmation surgeries are rarely performed on transgender and gender non-conforming youth. Treatments considered as gender-affirming healthcare are used not just by transgender people, but also by cisgender people, whether that be hormone therapy to ease menopause or breast reduction surgeries for conditions such as gynecomastia. On day one, I will sign an executive order instructing every federal agency to cease the promotion of sex or gender transition at any age. They're not going to do it anymore, Trump said at a Moms for Liberty event in August. Trump's pledge and upcoming inauguration comes amid a wave of laws proposed in state legislatures seeking to ban or restrict gender-affirming care for transgender youth, and subsequent legal battles over those laws, such as the U.S. Supreme Court case between three families and a medical provider challenging a ban on gender-affirming hormonal therapies for youth in Tennessee. We would like to hear from you. What impact will these changes have on you, your family, or your loved ones? Send a message to info@paequality.com or just leave a comment here on Facebook or over on Instagram. That's it for today's News Blast. Before we get back to music, let's check the weather first.